Okay? I want you to close your eyes and imagine for a moment the lights in the room are being so bright that they hurt your eyes, to a point you can't focus. It hurts. You may even desperately want to leave the room, but you can't. Now imagine you are in a room with a group of your peers and you are being required to sit, but you cannot get your hands to stop moving. And you're moving your hands are so distracting that no matter what you do, you cannot focus on the important instructions that are being given to you. Your instructor asks you to repeat the directions given, but you can't. Finally, imagine not being able to understand or possibly being unable to communicate why these everyday things that most of us don't even notice are causing you such discomfort, anxiety, inability to focus, or maybe even pain. This is a daily reality and struggle for many children and is something I see and help work to address every day as a special education parent. According to the University of California, San Francisco, 5 to 16% of children are affected by a sensory processing disorder. Two of the most common disorders that suffer from a sensory processing disorder as well are autism spectrum disorder and attention deficit hyperactivity disorder, ADHD. According to WebMD, SPD, or sensory processing disorder, is a spectrum disorder, and despite many experts agreeing that it should be its own distinct disorder, it is not currently recognized as such. There are two types of processing disorders, sensory processing disorders. Hyposensitive, which is under-responsiveness, and hypersensitive, which is over-responsiveness. Hyposensitive means that a child or a person will seek out a firm touch, can sometimes be fidgety, or seems to have the need to move, or has the need to chew, an oral fixation. A lot of times they have difficulty processing language, more specifically spoken directions or information. Hypersensitive affects a person when the lights may be too bright or the volume is too loud. When to someone who doesn't suffer from this disorder, it is a typical volume or typical light. Sometimes they struggle with aversions to food, such as too crunchy, too soft, too hot, too cold. According to autismspeaks.org, they suggest the following accommodations for hyposensitive. They recommend a weighted blanket for the firm touch, physical activity, such as jumping, running, catching, visual supports, and moving furniture in a way that a child or person can avoid being harmed. Also, they recommend fidgets for their hands, like the fidget spinners or sensory bottle, something along those lines. Now, for the hypersensitive, they recommend earplugs or headphones to soften the sound, sunglasses or light dimmers to help with the brightness of the lights in the room. They also recommend high-walled cubicle type areas to help with eliminating distractions. Also being more aware of the strength of the perfume or scents in the room, asking before touching, and also being more aware of the clothing that a person is given or purchased for. Sometimes it can be too tight or not tight enough. In conclusion, next time you see a child or even an adult who appears to be picky or overly sensitive, remember they may be struggling with a sensory processing disorder, something that doesn't affect you or eye may be causing someone a great amount of anxiety and discomfort. Remember to be kind, be understanding, and be patient, and to offer help when you are able.